Hi everyone, it's Andrea from AndreaTooley.com, and I'm here with Dr. Ali Charafeddine, who is a plastic surgery resident here at Mayo Clinic. And Dr. Charafeddine is going to tell us everything about plastic surgery. So if you're interested in plastics, you better keep watching because this is going to be really good. Okay, so Dr. Charafeddine, can you just get us started? Tell us who you are, where you come from, what are you doing, all that kind of stuff before we kind of dive into plastics.
Thank you for having me.
Yes.
I'm a first-year resident at Mayo Clinic in the independent pathway for plastic surgery. That means I'm someone who did 5 years of general surgery first and then match into their program for plastic surgery. I grew up in Lebanon. This is where I went for medical school. And right after that, I did some research, started my training at Emory and Albert Einstein, and finished here for plastic surgery.
That's wonderful. Thank you. So originally from Lebanon, but then you did medical school here in the U.S. Is that correct?
No, I'm a photomedical graduate. Actually, I spent a lot of time in the lab after medical school, trying to get a better resume. As you guys know, being a photon grad and applying for plastic surgery is something really tough.
Wow.
So I was very lucky.
That's fantastic. And now you're a plastic surgery resident here at Mayo Clinic.
Yeah.
So can you tell us, you said something about an independent plastics pathway versus another plastics pathway. So can you kind of go into all of that? Like, if you want to be a plastic surgeon, how do you get there? What is the path from college to medical school and then onwards?
Okay. There are two pathways to go into plastic surgery. The first one being the independent pathway. This is the traditional one. And actually, most of the programs are moving away from the traditional one, which means you have to do 5 years of general surgery first, and in your 4th year in general surgery, you go in a match. It's a San Francisco match. You go in a match, and you go for 3 years of plastic surgery. The other pathway is the integrated. This is the most common. For example, at Mayo Clinic, this year we switch to only integrated applicants. So yeah, right after medical school, you go in for 6 years total for plastic surgery, and you'll be done in 6 years, saving 2 years of general surgery.
Okay. So if you did the independent pathway straight out of medical school, you would just apply for general surgery residency. And then during your gen surg residency, then you apply for plastics. And so you do that for an additional 3 years? Mm-hmm. Okay. Versus the integrated, where you apply straight out of medical school into plastic surgery.
True.
And then you just do plastics the whole time.
That's true.
Okay. And are there pluses or minuses? You said, people are kind of going more towards the integrated, but are there reasons why you would do one over the other?
So from my conversations with a lot of medical students, seems like a lot of people go into general surgery not very sure that they really want to do plastic surgery.
Oh, sure. That makes sense.
So that gives you the option of applying to, in your 4th year, if you change your mind, you can apply to trauma, pediatric surgery, cardiac surgery, vascular surgery, all types of surgery or surgical subspecialties.
I see.
But again, people have to be careful that some of the top programs in this country have switched from independent into integrated.
Okay.
Like Duke have switched completely to integrated. Emory switched. We switched. So they have to be careful about this pathway, about the independent pathway.
Okay. All right, so I understand if you're doing general surgery, then you have all these different surgical specialty options.
Yep, they're open.
And probably still plastic surgery, but maybe not.
Yep. So
if you're thinking about doing plastic surgery, then if you're fairly certain that that's what you want to do, then you should aim for more of the integrated pathway.
And the integrated match for plastic surgery is really competitive.
Very competitive.
The applicants are extremely smart. They're doing a lot of research already, like in their 2nd year of medical school. They stop for some time in the lab. So they're applying with a lot of papers. They're really good. Because we review some of these applicants and we interview them when they come here. And they're really, really good.
Okay. Well, I definitely want to talk to you about what your tips and suggestions are for people who want to match into plastics. But first, if we could just back up, can you just give us an overview of what a plastic surgeon is, what they do, what kind of the career and lifestyle? Because I think people don't understand the full scope of plastics and all the things you can do.
Yeah. So there's the plastic surgeon that you see in the media, and the real life plastic surgeon.
Right, totally different.
Completely different.
Yeah.
The media really has a different perspective on plastic surgery. A plastic surgeon is someone who helps all type of patients both sexes and all ages.
Mm-hmm.
We operate on kids who have congenital deformities.
Mm-hmm.
We operate on the elderly. We operate on patients who have cancer, like we were
Mm-hmm.
just talking before the interview started.
Yeah.
And we all do all type of operations from head to toe. So we do craniosynostosis operations in kids, for example. Those are born with some congenital deformities of the cranial bones. We do some cosmetic surgery. Also, cosmetic surgery is part of plastic surgery, but
Mm-hmm.
it's not the whole field of plastic surgery.
Mm-hmm.
For example, in cancer patients who have breast cancer and get a mastectomy, they go to a plastic surgeon.
Yep.
For the reconstruction.
Sure.
Or cancer patients or patients who have cancers inside their abdomen that need some type of reconstruction, or
Mm-hmm.
patients who have sarcomas in their legs. So in order not to lose that leg, we help the cancer surgeon in the reconstructive part of the whole process.
Mm-hmm.
So plastic surgery is head to toe, all type of operations, not only cosmetic. It can be cosmetic, craniofacial. Microsurgery is also a part of plastic surgery, and all sexes are involved. We can help everyone.
Wow. Because I feel like some people, they think that when they hear cosmetic, they think strictly more of a vanity type of sense. But cosmetic can also be kind of a functional property too, because some things, they function more properly when they look a certain way. And so doing a cosmetic procedure isn't just for looking right, but it's for functioning correctly as well.
This is an excellent question. The function of the face,
right, is to
look
like a face.
Like a face.
Exactly.
So when you have a trauma to the face with a big laceration or a big defect in the face from some Mohs surgery, from cancer,
Mm-hmm.
you need plastic and cosmetic surgery to return the face into its function of looking like a face, so the patient can reintegrate nicely into the society that is. So and the ultimate operation in the face is the face transplant. You've seen that plastic surgeons have done face transplants.
Yes.
Or for the hand,
Incredible.
plastic surgeons are doing hand transplants.
Mm-hmm.
And probably your viewers don't know that the first kidney transplant operation was done by a plastic surgeon, by Joseph Murray,
really?
At Harvard in the early 50s, and he won the Nobel Prize for it. And the first kidney transplant done here at Mayo Clinic was done by a plastic surgeon.
Wow.
So plastic surgeons are really at the forefront
Mm-hmm.
of science, at the forefront
Surgical
of research, and for
innovation.
surgical intervention. Yes, and innovations, yes.
Wow, that's so cool. Well, that's such a great example of all the different things you can do as a plastic surgeon. Give us a little bit about why you chose plastics. Why did you decide to do plastic surgery?
So I decided on plastic surgery in my third year of general surgery. In the beginning, I did a lot of research on transplantation, organ transplantation,
Mm-hmm.
and I did research on hand transplantation.
Cool.
And when I did my clinical rotations as a PGY3 general surgery resident, I enjoyed the plastics rotation a lot, much more than the liver transplant or the kidney transplant rotation. So I decided to go into plastics. So I applied in my fourth year, and again in plastics, you help a lot of patients. You help everybody, and you operate from head to toe. So you don't get into this routine operation style. You know, like one day you're helping a child with a cleft lip or a cleft palate.
Mm-hmm.
The other day you're helping a lady with a breast cancer, giving her reconstruction options.
Mm-hmm.
And the other day you're doing a free flap where you're operating under the microscope. So it's a lot of fun.
Yeah.
There's a lot of things going on.
Lots of variety.
Yes.
What is kind of the day in the life of a plastic surgeon? I know there's so much variability in terms of what you do, but talking about like how much time you spend in the OR versus in clinic, or how many hours a week, people always want to know, like how hard are you going to be working? Those kinds of things.
Life as a resident is like every other residency.
Mm-hmm.
You work hard, you wake up early in the morning, you round on your patients. You might have a big service you have to round on, or a small service.
Mm-hmm.
But as a consultant, or as an attending, or as someone in private practice, you can tailor your practice the way you want.
Okay.
You can have a busy cosmetic practice, or 100% cosmetic practice. You can have 100% reconstructive practice, or you can have 50-50, or any percentage that you choose to have.
Okay.
There's no real emergencies in plastic surgery at night, unless you're like doing really microsurgery and your flap goes down at night.
Mm-hmm.
But the emergencies, it's not like general surgery where someone comes in with a bad abdominal problem that you have to take them right now to the operating room and do something for them. When I take call here for plastic surgery, usually there's not a lot of times when you have to go run to the operating room in the middle of the night.
Okay.
So if you're asking about the lifestyle, usually the lifestyles of a plastic surgeon can be dictated by the plastic surgeon himself.
Okay.
You can tailor your practice to the way you want to have your lifestyle.
That's great. All right. And then what about fellowship after plastic surgery too? Because I was just thinking of this, how you were talking about you do your residency, maybe general surgery or maybe the integrated plastics. But then if you're tailoring your career into more just cosmetics or more just microsurgery, are there fellowships after
Yes.
plastics? Okay.
So at the end of your general plastic surgery training, usually you're comfortable doing all type of operations.
Mm-hmm.
And depending on the program you go to, you might be stronger in some areas more than other areas.
Mm-hmm.
And if you want to tailor your practice, let's say you want to be a cosmetic surgeon, you just want to do cosmetic surgery, you want to be up to date on cosmetic surgery.
Mm-hmm.
There are cosmetic fellowships that you can go do for 1 year or 6 months. Most of them are 1 year.
Okay.
If you want to train as a microsurgeon, if you really want to do more of microsurgery, you can go train in these microsurgery fellowships,
Mm-hmm.
and you spend 1 year doing just free flaps. If you want to do pediatric craniofacial, so you go spend 1 year operating on pediatric patients who
Mm-hmm.
have congenital deformities. So you really can do more training if you want to. But a general plastic surgery, 3 years should be enough for the general plastic surgeon.
Okay. Wow. And so most of the fellowships are just a year. That's great.
Yeah.
That's really fantastic.
You can even apply for facial plastic surgery residency or fellowships.
Uh-huh.
Usually these are ENT-based fellowships. If you really focus on the face,
On the face.
do rhinoplasties, facial reanimation.
So cool.
These are really nice operations. These fellowships are also available for the plastic surgery resident.
Wow. I think that's such a great overview of life as a plastic surgeon, the career opportunities, the training. That's so fantastic. So I have a lot of viewers here on YouTube who are interested in plastic surgery, who want to know all about it. And so if you are a pre-med in college or new in medical school, medical student interested in plastics, what advice would you give to them? What do they need to be doing? What are the biggest things in order to match into a plastics program? Because it's hard.
The game starts early on.
Yeah.
So I would hook up with a plastic surgeon in your home institution and try to write papers with them. If there's somebody writing a book chapter, ask them if you can help them write the book chapter.
Okay.
Or if there's a lab, if there's a plastic surgery lab, go to the lab, talk to the fellow, see if you can. Like I have 4 or 5 medical students right now helping me with a lot of projects, and they're fantastic. They are fantastic, and they work so hard, and they're so smart. It's really humbling. So you have to start early on. Try to score as high as you can on your exams, and have good letters of recommendation. I think if I would give you one advice is find that plastic surgeon in your institution that you think is very nicely connected, who publishes, who's known in the academic world, and try to help him, offer him your help doing his projects or his research or his papers, and that really helps a lot.
Yeah. Okay.
And OA rotations, when you do your OA rotations.
Good advice.
Try to shoot for your top 3 programs. Like if you know what type of program you want to go to, what programs you really like your top 5, try to schedule electives in these places. So when they know you, when they see you, try to do a good job. They will remember you during the match. That's how it really works.
Yeah.
They will remember you during. If you go there and you work hard, you're the first one to show on the team. You're helping the intern, and your intern thinks very highly of you. Your chief resident thinks very highly of you. That helps a lot.
That gets you an in.
Yeah.
That's such great advice.
Yeah.
Well, so you're just such an incredible inspiration. I mean, you're a foreign medical graduate. You've done all kinds of research. You're going to be this fantastic plastic surgeon coming out of Mayo Clinic. You have 2 beautiful daughters, family, and just it's such an amazing aspiration, and we all want to look up to you.
Thank you so much.
It's true. So what kind of advice do you have to everybody out there? You've been so successful. Like, what do you think has gotten you this far? And
just work hard. Just work hard. You don't have to be a genius or I was never top of my class in medical school, but just work hard. So just work hard, and things will open up very nicely.
That's great advice. Yeah. Anything else you think the budding plastic surgeons need to know?
Always remember that we're not the plastic surgeons that the media draw a picture of.
Yeah.
We help all kind of patients. We help a lot of sick patients in the hospital. I wish good luck for everyone, actually, who is working in plastic surgery or who's a resident in plastic surgery.
Great. Well, everyone, I hope you enjoyed this video. I feel like there are going to be a ton of people begging for a part 2. And so if you have other questions or other suggestions for another video, please leave your comments below. We'd love to hear from you. Thank you so much for watching. I'm going to post all of your social media, or if you have any connection kind of links in the information for this video. So if you like it, click subscribe so you never miss another video. And thanks so much for watching, everybody. Thank you so much.
Thank you.